Hi, this is Pat Iyer with Legal Nurse Podcast, and today we're going to be talking with a guest who has a real deep insight into how the healthcare system works. He's not a physician. He works with physicians. He's a certified speaker, which means a certified speaking professional, which means that he has achieved a designation that is quite rare within the speaking industry. He's a consultant, he's an educator, and he specializes in working with medical and scientific personnel who are charged with leading their peers. Kevin has graduate degrees in education, counseling, psychology, and spirituality, and he focuses on the challenges of leadership, business relationships, and team effectiveness. I have with me Kevin O'Connor, who I met through the National Speakers Association, and have purchased his books in the past on presentation techniques, and I knew he had a lot that he could bring to you. So, Kevin, welcome to the show.
Thank you. Thank you, Pat.
We talked when we met about the focus of your expertise. The legal nurse consultants who are listening to this program, and they are listeners in 72 countries at this point.
Okay.
They know the clinical world of working with physicians, and they also know the legal world. When we get involved in a case, if it's a medical malpractice case, it's because the team has broken down, the communication has broken down, something has happened. We're seeing not all the success stories, but we're seeing the problems. And I thought you might be able to give us some insight into the dynamics that occur in the team when a problem occurs. What are some of the factors that you've seen and you've worked with that help to lead to patient safety errors?
Yeah. One of the things that I've noticed is, just in my view, there's three things. There's employment, and that's when I have a job and I'm doing my role. You ask somebody, what do you do for a living? They tell you what they do for a living. I'm a nurse, I'm a doctor, I'm this. Then there's management, where we're supposed to be in control of a team, and we're moderating and we're working. And then there's a third one called leadership. And leadership is different than the other two. And I think when we think about our role when dysfunction is happening or when we're called into a difficult situation, I think if we go in not as someone who has a job to do this, not as someone who is managing these people, but rather as someone who is being called to lead these people. And that means I'm going to come in fully aware of my ability to help this situation get better. It doesn't mean I have all the answers, but it does mean I'm going to try to make things a little better here. And so, but I'm coming in with the full force of my solution, my inner expertise, my inner expert, and I'm going to bring that to the table. So I think one of the things that's really, really important, and I've listened to some of your podcasts in the past that seem to have the same theme, which is it really has to do with us. What's my role in this, and am I going to step up to the table? A doctor told me once that he was attending a meeting. He said, I don't have to attend the meeting. He had just gotten employed as a physician. After 30 years in private practice, he sold it to the hospital. I said, how's it going? He said, well, it was great for about 3 months. He said, but then they started treating me like an employee. And I said, oh my goodness, really? He said, what's worse is, he said, I started acting like one. And he said, I'm at tonight's meeting because I've heard you're either at the table you either are at the table or you're on the menu. And he said, I don't want to be on the menu. He said, I want to be at the table. And I think when we come to these meetings and we say, I don't know what's going on, but I'm at the table, I am fully present, it's a big deal. So one of my students is a lawyer, and she does mediation in the juvenile court system. She said, I used to ask a lot of questions. And she said, now I'm learning that if I listen first, so that people get, all my clients who are many times adolescents in trouble and who are afraid, she said, I understand if I listen first. She said, then the questions are easier to answer for them later. And I think sometimes if we come in thinking I have to ask a lot of questions, we're better off if we listen. So I think the keen insight that I've gotten from nurses and from physicians in the past is when they listen, they engage. When they start asking questions, distancing can happen if it's done too early.
When I first got hired to work as the staff development coordinator of a large hospital, I decided to spend a week working on each one of the nursing units in that first 6 weeks that I was an employee.
Oh, yeah.
And my peers who were working with me said, "Why are you doing this?"
Yeah, right.
And I said, "I'd like to get to know people."
Yeah.
I had learned in graduate school about the concept of being a change agent,
Yeah.
and realized that the best way that I could develop relationships and establish my credibility was to show the nurses in that hospital that I could do their job.
Yeah.
So
Right.
I spent 6 weeks in that role, and it was probably the best 6 weeks that I could have ever spent in
Right.
demonstrating
That's right.
my commitment to the people that I would be teaching for the next 7 years. And in that process, I learned how the hospital really worked.
That's right.
We don't really fill out incident reports if we give Tylenol by mistake. It's not necessary to do something like that. That was
right.
one of the things that I recall a head nurse telling me. And a number of other eye-opening experiences when you're listening and not coming in and acting like you're in charge.
That's right. There's a physician, I think he's still at Stroger Hospital, which used to be Cook County Hospital in Chicago, which gets a little bit of everything. And he said every Thursday afternoon, he said, I round to all of the nurse stations and I ask them, what do you know that I don't know that I should know?
Ooh, that's a good question.
That's a great question. And he said, and then I also asked them, what is it that I can do that would make your job more about what you want your job to be for these patients? And he said the first few weeks, they looked at him like, yeah, what's this all about? He said, but once they trusted me and they knew I was not going to stop doing this every Thursday afternoon, he said they were ready for me. And he said, I learned all kinds of stuff that I would not have learned if I'm in my office or even if I'm rounding and saying, how's everything going? He said, that's not a question that's useful. He said, if you ask a question that pinpoints something inside of them, he said, and they trust you. Trust is a big deal. He said, then that comes out. And he said, then you learn a ton of information. A lot of physicians who are administrators and leaders say, well, I have to practice a little bit to gain credibility with the other doctors, because if I don't act like a real doctor sometimes. So then they do, I say, well, what do you do? And they say, well, I'm at the charity clinic 2 hours a month. I said, geez, are you still safe? He said, oh yeah, I ask the nurses if I'm making any mistakes. And then I ran across a female doctor who, she said, I have not done any clinical practice in 15 years. She's very, very successful, very popular among her doctors. I said, how do you do that? I said, you're not doing any clinical practice. She said, if they don't trust me as a leader, then I'm not doing a good job as a leader. She said, my job is not to be a clinician anymore. My job is to be a leader of clinicians. I thought that was really very, very interesting. She has a different kind of mindset. And in a different way, in today's paper in Chicago, they recounted a story of, John Bon Jovi, the rock star that goes around the world, the group Bon Jovi. He was on a cruise in Spain.
I think he's from New Jersey, actually.
Okay, all right, okay. So he's one of the most profitable rock groups. He owns the band, and then he gave it his name. But very, very, they make a lot of money. They're very popular. So he was doing a cruise in Spain, and one of our local women who has cerebral palsy for the last 40 years went with her caretaker. And Bon Jovi said, I want to have somebody come up and sing a song with me, but you got to know the words, you've got to be a singer, and I don't want you to try. I want you to do it. And all of a sudden, her caretaker raised her hand and got up there and I guess had the memory of a lifetime. I thought it was very interesting. He said, I don't want you to try to be good. I want you to be good. And I think when we bring ourselves to the table, it's so important that we come with that full sense of ourselves. And I think it's something that you feel from someone. And I think a doctor feels it from a nurse, and wants to feel it from a nurse. A doctor wants, when I have students who say, well, I'm going to try to do this, I tell them, I don't want you to try, I want you to do it. And all of a sudden they take on a kind of different persona.
Mm-hmm.
Dr. Dreikers, the famous psychiatrist from Chicago, used to say to his patients, try to get out of your chair. And so they would start to get out of the chair. He said, I didn't tell you to get out of the chair. I told you to try to get out of the chair. And all of a sudden it became very obvious the difference between try and do. And I think when you're a nurse regardless of your capacity, but especially when you're advising difficult situations or you're involved in difficult situations, don't be a bystander. Don't lean back in your chair. Come at it with the full force of your knowledge. You are if you weren't important, you wouldn't be at the meeting. And when you're at the meeting, you shouldn't be on the menu. You should be at the table.
Well, and I think sometimes nurses get on the menu because even though they're supposed to be patient advocates,
right,
it's extremely intimidating to challenge the chain of command and to carry a concern to a physician department head who could be understanding and accepting and concerned, or could be dismissive and punitive for exposing a problem.
Yeah,
that's the risk that nurses face every time there's something clinically going south, as we say.
That's true. Yeah, yeah. And I think when it does take courage to meet that, it doesn't mean that you have to be the irritant. It doesn't mean you have to be the voice of doom or Debbie Downer when you're walking in. It does mean that you are walking in as a co-equal. I know some stuff and you know some stuff, and I want to collaborate with you. And for sometimes you're going to say, do we want this on the front page of the Daily Herald in Arlington Heights, Illinois? Are you sure this is the right decision that's good for all of us? I want to collaborate with you. So if we continue to do the collaborative technique and we continue to offer our expertise, but first listen to the other person. They have to feel that you've listened to them to make a difference. Here's an example. I was talking to a fellow a few weeks ago, very, very bright guy, not in my area. And I was talking to him about an issue of something that he volunteers at. And it was very clear in the beginning that he was feeling a little defensive. He was coming at me with all of his arguments and all that kind of stuff. And so then all I started doing was paraphrasing him. And I tried to do it not by repeating what he said, but by paraphrasing to the core of what he was saying. So I was using my words, but I was mirroring his ideas. Later, I took out a piece of paper and I started drawing a little diagram about it. And it was very interesting. At the end, I offered him the diagram, which I do all the time. I usually do it on a paper napkin because we're at restaurants. And then I offer it to the person. I say, do you want to keep this as a reminder? And everybody kind of grabs this napkin. It's hysterical. And later, when I'm in their office, I see it pinned to their bulletin board. Is that napkin from 2 years ago? Yeah, wasn't that a great meeting? So it's a visual reminder to them. So I offer it to him. He said, no, I'm okay. And I thought, really? You're going to be the first person in the world not to take my important diagram So I left that day feeling kind of like, I don't think I really nailed it. Later, 2 weeks later, he's talking to another person about that meeting who I know. That person came to me and said, he showed me this diagram. I said, he doesn't have the diagram. I have the diagram. She said, no. She said, he reproduced the diagram as we were talking and told me, you know what I liked most about that lunch? I felt heard. Very interesting. Now, I was blown away by that. And then it reminded me again of the importance of feeling heard. As soon as he felt heard, we were co-equals. I know stuff, he knows stuff. And I think it's really important for nurses to think this way, especially around what might be seen as dominant or authoritative or bossy bosses. Even bosses want to be heard. But sometimes what they get are questions, or they get statements, or they get judgments. And or they get advice. Really what they want is somebody who will listen. And when you're listened to, that's the beginning of change. The American Psychiatric Association said, change happens when I feel listened to, when I feel like you're interested in me, when you help me focus, and when you encourage me. That's when change happens. And it happens in our marriages as well. Sometimes we want to give advice to our spouse. Sometimes we want to point out the problem they had and all that sort of stuff. When in fact, if we do those things, they're closer to us. They're much more likely to change. In fact, Rikers used to recommend that when you're arguing with your spouse, you should hold hands with your spouse while you're arguing, because you can't possibly say all the bad stuff you were thinking of saying, because the connection is so strong, right?
Mm-hmm.
And you can't do this with your boss. You're not supposed to. But you can remind yourself of how important the connection is. The connection is not going to happen because you barge into somebody's office and tell them what the real deal is. It's not going to happen when we go in and think that we know more than they know.
Mm-hmm.
It is going to happen when we bring our full understanding of what we know with the skills that I think everybody ought to have. Nurses, lawyers, grocery store clerks, which is the skills of paraphrasing, empathy, understanding.
Well, there certainly can be things that our skills are important for us as business people when we're interacting with our clients who are
Right.
trial attorneys as well.
Correct. Yeah.
I thought maybe you could give us a little perspective, Kevin, on the changes in healthcare, because many of us came into healthcare at a time when there was a very authoritarian model in the medical model of the
Correct.
doctor was in charge, the nurses were to take orders. And all of that has changed to much more of a collaborative team model.
Yes.
We see, as I mentioned earlier, the situations where the communication breaks down. Can you give us some insight about what has been done within the physician world to help physicians give up that top-down approach? And are they getting it? Are they understanding?
Right. Well, I think they are the ones who are becoming leaders in a formal way. I think they not only get it, but they have to get it because they're employees, and they're not going to last long on a team if they try to pull the authoritative thing. I think other physicians have, I think one of the problems that we have, and sometimes surgeons and cardiac docs and all that get a bad rap because of what happens to them. And I think what happens is what we get from them is not them demeaning us. What we get from them is their anxiety. They have been told they have to be perfect since probably high school, right? Certainly they're supposed to be perfect when they're doing a procedure. And they know the full weight of that procedure is on them. They think the full weight of that procedure is on them. And so can you imagine, try to imagine for ourselves, what's that like if the full weight of the procedure, even though I have a team, is on me? And I think then the collaboration piece to them is kind of hard to figure out a little bit. So one of the doctors I was working with in a surgery situation, I was observing some of the surgeries. And in this hospital, maybe they do it everywhere, they don't just do a timeout for what leg are we operating on, but they introduce each other, even though they've been working together for 9 years. I'm so-and-so, I'm the surgeon. I'm Bob, I'm the anesthesiologist. I'm Cindy, I'm the OR tech. Goes around like that. And this guy he's sort of he was the stereotypical problem surgeon. And so my job was to see if we could change things. He actually introduced me and he said, "Oh, that's Kevin. He's my anger management coach." So he knew what was going on. He just didn't know what the skills were. So we come out of the first operation and he said, "How'd I do?" because he knew I was observing him. I said, well, it was good. I said, you know, the thing that I noticed though was, I said, everything we talked about for the last hour was about what you wanted to talk about. Nothing was about them. And so everybody responded to only what you were talking about. He said, huh, I didn't notice that. I said, well, FYI. We go into the second operation, and all of a sudden he becomes Mr. Dale Carnegie. And Bob, how are you? And Cindy, what's going on with you? And blah, blah, blah. We went on like this. They're looking at me like, what the heck did you do to this guy, right? We come out of that operation, and he said, how'd I do? I said, well, it's certainly different than the first one. He said, I've never done anything like that before. I said, I know. He said, I didn't know Cindy was getting married next month. I said, how long have you worked with her? He said, about 9 years. I said, really? I said, I don't think you're getting an invitation to the wedding. Now, in school, we call this a corrective emotional experience. He had never had the experience of what is it like if all of a sudden I, as the physician, decide to listen to my staff. And for him, that was a huge moment that allowed him to say, oh my gosh, I never even thought of that. Last night in my class, a student would say something of what they learned or what was important to them. And my co-teacher said, before anybody else offers an idea, I'd like you to tell so-and-so, what did you like, learn, or appreciate? This is the skill of encouragement, about what they said. We had a sub-discussion about what the person said, and as soon as they started hearing what other people liked, learned, or appreciated, all of a sudden you could see a corrective emotional experience happen. For some, it bonded them a little bit better. If you say to anybody, and I mean anybody, you know what I liked about what you said? They never say, no, I don't want to know what you liked about what I said. They always lean forward. So, and this is not sucking up. This is called encouragement. You have to find something you really do like about them. And when you do that, they bond closer to you. They're more likely to hear you. They're more likely to then take the next right step with you.
Those are such important communication skills.
Yeah.
Your story reminded me of one that one of my podcast guests told me about working in an emergency department with a new ER director who within 9 months took a perfectly functional team and created turmoil with people wanting to leave, calling in sick when they knew he was on the schedule.
Right.
And she confronted him after he chastised her publicly in front of 2 shifts for something that she had said or done. And she pulled him aside and said, look, you got to get this straight. You are the leader of this department, and people want to leave and they're looking for jobs. And even if you go somewhere else, you're going to take your mouth and your personality with you. You have to learn how to fix this.
That's right.
So the next day he brought ice cream and donuts for the staff. That was his corrective action. She has recently resigned her position, and you know, clearly he hasn't fixed the problem. Yeah.
Well, nobody taught him. You know, nobody teaches them how to do, and this is not only in that profession. There are some nurses. There are some maintenance people. Nobody really onboards them, tells them what is it that has to happen. They don't give them an experience of themselves. They just say, you're hired, go do this, lead the team, you're in charge of this team. And I think many of us take this old European model of superiority and inferiority. It's called a vertical way of looking at things instead of a horizontal way. I'm important in my own way, you're important, we can work together. The medical schools now are trying to do a little bit more of that. I think the generation they're working with is much more used to working. Some of those kids, some of these young doctors have been in Montessori schools. Some of them have been in schools where a team is the deal. They've gone through, maybe some of them have gone through their MBA. Some doctors now have gone 10 years, they've been engineers, and all of a sudden now they go back to medical school. So one doctor said to me, he said, anybody can be a doctor if you just give them 8 or 10 years to do it, 8 or 10 years to do medical school. He said, it's a data dump. And he said, if you think about it, he said, most of medical school is self-taught. he said, if I have to rely on the lectures, he said, I won't pass any of the exams. So he said, now some of them say it was terrible, some say I loved it, but they said it's just a constant barrage of data and tests. Now, if I put myself in that mindset, when would I have time to learn about my interpersonal skills? When would I have time to learn what the difference is between managing change and leading change? When would I have the ability to know how to present to a group of people so I don't just dump data on them too, but how do I make it more interesting? How to make it stick more? So all of these skills are things they don't know. And when they emerge, many times it's the clinical nurse that's going to teach those new doctors for a while. They're going to rely on him or her to help them. The place I love to go to in a hospital is the ICU, because there it's really a team. It seems like it's really a team sport. The doctors are relying on the nurses, nurses on the doctors, the techs are involved. Even housekeeping is an important piece there in a team way. And I think if we can give everybody, if that can become the standard, that we work as a team and we give feedback to one another, and we start the feedback with what did I like, learn, or appreciate, I think that helps people start to understand, yeah, I see what you mean by that. Rather than, so it becomes a corrective emotional experience, not a corrective experience that's kind of a slap on the hand. We don't want to insult the ego. And, you know, I don't know if it's still true, but I have heard that older nurses are not always real nice to the newer nurses. That many newer nurses wind up leaving, not because of doctors, but because of the senior nurses. So this,
yeah, I think that's been an issue in nursing for sure.
So the superiority inferiority is a model that can go anywhere, and even in parenting, so that I'm the boss, children should be seen and not heard, all that sort of stuff, instead of a more collaborative model that talks about really helping children learn the skills of conflict resolution and what does cooperation really mean, and what does it mean to be treated with respect. You know, as long as we're treated with respect, usually we can stay in the same room with each other. As soon as I'm disrespected on either end, I am mentally out of that room. And that's what we have to be really careful of, is sometimes people say, really, I'm out. They don't physically leave, mentally they're gone, because they've lost trust. And so I think when we start helping all teams understand some of those concepts and not just think of them as you have to do this, that, and the other thing. I think that, you know, my attorney in my class who works in the with juvenile mediation, it was very interesting to watch her just come to an awareness last night of when I listen, I get more. When I ask questions, the defenses raise unless I've established trust. And you establish that by listening. Yeah. Yeah.
Well, those are communication lessons that apply everywhere, don't they?
Yeah. Yeah. And I think, you know, I did it today, and we recommend people do it in their interviews, and I'm recommending people also do it in their jobs. And that is, I'm not a sports person, so I don't know who this man is, but apparently there's a football coach named Bill Belichick. And Belichick has a card that he uses, and when he does the plays, he puts it in front of his mouth, so you can't lip read and see what the play is. On the card are all the plays that he plans to use for the first quarter of the game. So as he's looking at it, it's covering his mouth, but he's also looking at, oh yeah, we have to do number 68 today, and we have to do number 27. And I'm recommending when people go for a job, especially our doctors, that they make a play card. And there's some stories they're going to tell in that interview. There's some statistics. There's some personnel stuff. There's how do I handle this situation? And of course, you can't take it in the interview. So we ask them to memorize it. And when they go in, they are coming in not as just a receiver of questions. They're coming in as an expert in themselves. And so what would happen if at meetings, instead of coming in with an agenda, you and I and all of our colleagues come in with their play card for that day. Here are the 3 things I'm going to say at this meeting, regardless of what the agenda says. Here's a story I'm going to tell about something that just happened to me. We're not relying on our memory. We have it. My play card is right next to me right now. Now, I've memorized it. I don't have to look at it very often, but occasionally I might glance at it. And because, as you know, I don't know what questions you're going to ask me today. So, but isn't that life? None of us knows what the next question is going to be.
It's true.
Right? Yeah, but if I have a play card, I know what I'm going to say, regardless of what's asked of me. I think it was Robert McNamara, wasn't it? The Secretary of Defense under Kennedy and Johnson that said, don't answer the questions they ask you, answer the questions you wish they had asked you.
Yes.
He knew in the 60s what a soundbite was.
Yes, I learned that in media training. Well, I'm going to ask you one question that I'm going to ask you, which is,
okay.
How can our listeners find out more about you and what you offer?
Oh, okay. So my website is kevinoc.com. And the books that I have are co-authored with Cindy Maxey, M-A-X-E-Y. So her name always comes up first, alphabetically. We've written 4 books on presentation skills, one of them specifically for women who are in scientific positions. We interviewed a lot of doctors. Our first book was based on regional medical liaisons who work in pharmaceutical companies, doctors, PhDs, PharmDs. Our editor in New York was a woman, and she said, why don't you write a book for presentation skills for women executives? And I said, is there a difference between when a woman presents, when a man presents? She said, go find out. So we interviewed a bunch of nurses, PharmDs, PhDs, MBAs, who were women in executive positions, doctors too. All of them said, oh yeah, there's a big difference. So then we wrote a book on that. So most of my work, I do about 80 presentations around the United States and in Europe per year. I've done some work at the Magnet Conference, as well as working with physicians and the American College of Healthcare Executives, and then teach 6 classes at Loyola University in Chicago. And happy to talk to anybody. My email is kevin@kevinoc.com. Happy to talk to anyone that wants to say hello.
Well, thank you, Kevin. And I
welcome.
appreciate the work that you're doing with the healthcare system.
Thanks.
To help improve communication, which can lead to better patient outcomes and less work for the medical legal system.
That's right. And I think we have to remember we're saving lives when we do this. I was just at the Health Executive Briefings Conference for the Joint Commission. The theme this year for those is to save lives. That what we do with safety and in hospitals, and I think we do it in the legal nurse profession, we do it in the courtrooms, we save lives. And if we can keep that in our mind, that's why we went into this business in the first place.
Mm-hmm.
Yeah.
Well, thank you, Kevin, for being a guest on the show.
You're welcome.
And thanks to our listeners who are soaking up the knowledge from Kevin. I know, Kevin, that there'll be people listening to this who will saying, why does it have to end? We want to hear more. So I appreciate you sharing your expertise with us.
Thank you. Thank you.
And thank you, everybody, for listening. And we'll be back next week with a new interview.